Okay, well, I am delighted to be here today with Dr. Ambaye. She is a leading fistula surgeon in Ethiopia, and you trained under Dr. Catherine Hamlin, who was, of course, the pioneer of fistula surgery in Ethiopia. And I know her name resonates with a lot of supporters out there. So they're very excited to be, we're very excited to be coming on board with you in the continuation of that work. And of course, your work being that 2 years ago now, you founded your own organisation, which is very exciting, under the name of Hope of Light, which I have to say I think is a particularly beautiful name, and I think really reflects the kind of work that you do. And you're now running 3 fistula hospitals across Ethiopia. So thank you so much for coming to this meeting today. And look, this is a really exciting meeting because we so many of our supporters in Australia that are really particularly passionate about fistula and the work that happens there. And we have actually got questions that have come from them that they've asked me to put to you. So if you're ready to go.
Yes, I'm ready, Sharon.
Wonderful. So look, Dr. Ambaye, can you tell us a little bit about your organisation, Hope of Light? What was it that made you decide to found the organisation? And obviously you do a broad span of work, but maybe just sort of the highlights or the headlines of the work that you do.
Okay, thank you, Sharon. Why the reason why to found Hope of Light is, before the establishment of Hope of Light, I used to work for an international organization called Women in Health Alliance International. And this international organization phased out or stopped working in Ethiopia in February 2020. So I'm a fistula surgeon. I'm a full-time fistula surgeon. I am dedicated for such kind of service. So when this organization closed, I felt empty. I mean, I have been working about fistula for more than 2 decades. I feel that I have a lot of experience. I'm so much attached with these people, and then I'm very happy to give the service to this woman. When I know that this project is this organization is going to be closed, then I said, what we are going to do? I mean, it's our work always should be sustainable. If we are going to, we have 3 centers established, working very well, treat more than 500 patients every year at the 3 centers. And then I decided I have to continue this work because the service we are going to be sustainable. And then I wrote this to Ethiopia UK, Australia, and Canada, and Ethiopia Fund in Norway. So these 3 organizations, were very much interested to help me and encouraged me to continue the work. And then I said, why not I established a local NGO? If you are willing to help me, I am really happy to teach the doctors and continue what has been started by WUHA International. And then I got a green light from these 4 organization donors, and then I established the local NGO in July 2020. Then I started to continue the work. That's how I started, the Hope of Light established. And then what it's doing now is we have 3 major activities. In fact, it's 4 major activities, what Hope of Light is doing. The first thing is to treat fistula patients and other patients with pelvic floor disorder and they are incontinent. So these are the main treatment, is the main focus of our activity. The second one is training of health professional training. Why we do the training? If we train the doctors, midwives, and clinical nurses, health officers, while they are doing their training at the university hospitals, we have a good chance to get in contact with such kind of health professionals, future health professionals. And then when they finish their training, they go to remote area and then they can apply, and at least they can prevent the occurrence of obstetric fistula. That's why we are very much interested with training. So the second most important activity is training. The third is, fistula is usually occurred in a very rural area where the victims are illiterate, they don't have enough money, they are poor, they don't have access to the medical care. So they give birth at home, and when their labor is complicated, they travel to the health facilities. So to avoid such kind of complication, I feel that it's much better to bring awareness among the community that all women should give birth at the health facility. Health extension workers, they teach them that fistula is preventable. If you can prevent it, if you deliver in the health facilities. This is the main important thing that we teach the community. And at the same time, we identify fistula patients. Fistula patients, they are always outcasted and they are not isolated. They don't talk about their problem openly with the community members, so they hide themselves behind the door. So our health extension workers with former fistula patients, they visit them, house visits. They do house-to-house visits. And they tell them, yes, you see, fistula is treatable. It's not your fault that you develop obstetric fistula. So these are kind of activities we teach the community to prevent. At the same time, we identify already victim fistula patients so that they can go to the hospital for treatment. And the fourth and most important thing is our reintegration program. The reintegration program, it is, sometimes I'm very happy that we are able to treat patients. 84% of our women, they are cured. But the rest, 14%, 15%, we are able to cure the fistula, but they are still leak a little bit when they cough, when they sneeze, or when they lift objects. But with time, they can. We give it time, and then most of them, they get better. There are few percent of our patients, like 2 to 3%, there's nothing we can do for them. Some of them have repeated surgery and they cannot. We are always able to close the fistula, but we cannot make them a continent. And the reintegration program usually focused on income generating activity. So now, so far this year in 2022, we started in one of our sites, Asala Fistula Center, to collect those patients who are not cured and who are not able to support for themselves. We train them to do soap, liquid soap and bar soap, and then we train them so that they go back to their village and sell this production. They will be able to produce this, and then they sell it to the community so that they can get some income generating, some money for them to support themselves. So these are the activity of what Hope of Light is doing since its establishment.
Wonderful. Well, thank you for that. And I think, look, for me, there's a couple of bits that it's so good to hear that it's big picture. You're not just going in and treating the fistula, but you're putting in place work to make sure that it changes the woman's whole life, but it's also taking it back into the community, and it's making changes that are going to change what's happening for the next generation as well. Wow. And it's hearing things like that are so very exciting, which kind of leads on but goes backwards almost to my next question is, what made you decide to do this? Why did you train as a fistula surgeon? It's not exactly a common thing to be doing, so why?
You know, it's the first time I went to the Fistula Hospital is while I was doing my residency program, we have compulsory 2 months attachment to the Hamlin Fistula Hospital. So I went to the Hamlin Fistula Hospital to do my attachment during my residency, and then I was very much impressed with Hamlin's, in fact, and their dedication to the patient, and it made me, what do I do for this woman? You know, these people are doing a lot. They are changing the life of the woman. If you see cured fistula patient, it's like reborn for them. It's their life will be changed completely. So I said, what do I do? What is my contribution? That this is the feeling I had while I was doing my attachment, my residency program. Yeah, I started to work with Hamlin. I'm very much impressed, and then Dr. Hamlin she became my role model. I have learned 2 major things in my life from Hamlin. The first thing is her dedication to her work. They were very much dedicated for what we are doing. And the second one is the love and care to the patient. It's, you know, it's not something that you get from the textbook. I just got it by working with her. That's what I know, and that's what I learned from Dr. Hamlin. So this is a kind of things that I'm very much interested to be dedicated and continue my work with the fistula patients.
So you've been, you know, doing your work for a while now, and you must be seeing change come through Ethiopia. I know the times have been challenging lately, but on the whole, what sort of changes have you seen in Ethiopia in sort of the terms of maternal health and I suppose the prevalence of fistula?
Yeah.
Yeah.
So there is a great change. Now it's my 3rd decade working on fistula. It's a lot of years. So from the beginning, in the first 13 years, I was working at Addis Ababa Fistula Hospital. The number of patients coming to the hospital, it's unbelievable. It's about 20 patients per week. It's a lot. And gradually it's going down. Now still there is a great improvement with the number of patients that we see at our center. There is a change. And then how did we get this change? And the first thing is there are a lot of health facilities construction. Even though it's not enough and it's not well supplied, there are a lot of constructions. There are a lot of construction of health facilities, and the road, there is an improvement in road construction. This also contributes a lot, and a lot of training, especially midwives. There are a number of new midwives trained, assigned in the countryside. I can see the improvement in the training of health professionals, construction of roads, construction of health facilities, contribute a lot for the improvement of maternal health in other ways to reduce the number of obstetric fistula.
And I think that's a lovely difference to hear, that you really are seeing a difference, and that there's less patients, but for the right reasons, not for the not for the wrong reasons. You say so there's still challenges out there and still things that's going on, and I know that life is particularly challenging at the moment. You know, you've been through the effects of COVID, which luckily were fairly short-lived in Ethiopia, really. But of course, you've been well, not the outcomes. You still have the conflict that's been playing out across Tigray, and I know has got far too close for comfort to the hospital in Gondar for sure, and it's having other negative effects on your work. Can you tell us a little bit about how, if you know, maybe any lingering effects from COVID, but also effects from the conflict at the moment, and what impact that's having on you?
Yeah, in the last till until the end of June, August, September 2021, the impact of COVID was very much, especially on our outreach activity, because we can't gather people for our activity. We were trying, but we were not able to do in our maximum capacity. It affects a lot, COVID. But these days, it's okay. We don't have that problem. What we have a main problem is the conflict, especially in Gondar, in the northern part of this war. The conflict in Ethiopia now, it is national-wide. It affects every people, emotionally and physically. It's socially. It is really a problem for one. It affects the living cost completely. When the country in war, in conflict, there is always shortage of food, transportation, because everything is to the war front. So the production, the force, the man workforce is also there going to the war. It affects very much. So this is not only in the northern part of the country, but it also it affects the activity in Jimma, it affects the activity in Asala, it affects the activity in Gondar very much. For example, when we do the outreach program in Gondar, we used to collect all the women and then, and then teach them. Now, there is nothing. There is no health facility. It's all destroyed. It's unbelievable. Unbelievable. Every health center. It's amazing. So once I went to the outreach program in Gondar, and I was told to have 8 patients, because the difficulties were 8 patients. But when I went there, I found 23 patients, and then I was wondering. And then when I see the number of fistula patients coming to the fistula to Gondar is increasing. Why? Because the health facilities are destroyed, and home delivery is getting higher, and all these health professionals, the midwife, doctors are not working because there is no infrastructure to work there. There's no one to help them. The conflict affects very much, not only in our service, it destroys the whole facilities for the delivery, facilities for care of the patient. And then this is the kind of thing. I am sure the number of fistula patients this year, next year will be high. Now it's limited because there is no transportation service. The movement is always limited because it's still under the task force. It is not easy place to go and then for the patient to come to the service. So all this will be reflected for the coming 1 or 2 years. The number of fistula, I am sure it will increase. This is how it affects. It affects the northern part of the country highly. It's unbelievable. It will take, all that I told you because of the construction of the health facilities, improvement in road, and all the trained health professionals that we were able to decrease. It's all comes to zero now. We don't have anything. So it's going to take years to rebuild this structure again. Until that, we see many women will end up in complication during their labor.
Yeah, I can imagine. Yeah, it'd be very, very challenging, very challenging indeed. Yeah. I won't keep you too much longer, but I would like to ask whether there's any. Is there any one particular patient that's stuck in your that always stays with you as a special case? It doesn't have to be because it was complicated, but is there one patient that really stands out as something close to your heart?
Well, I've been working with special patients almost so many years. This is my 30 years. Once I was working at the OPD, and then I saw one patient came from not very far from Addis, just about 5-hour drive from Addis. And then I said her, she had a fistula for 7 years. And then I said, why didn't you come all these years? She said, I didn't have money. I was waiting to get some money for all these years. And then I asked her, now you came to the hospital, and then how did you come? Who gave it to the money? She said, no, nobody gave it to the money. When I was separated from my husband, I got a calf. She got, there was a young calf. And then I was feeding and looking after this cow. And then for 7 years, now I sell that calf and got the money. Wow. And got the money to come to the hospital. Then, without knowing it, I started to cry. You see, I'm as a gynecologist, and then I say, what do I do for these people? It's, I started to realize that every day this lady was looking after this cow, this ox to be big, and then waiting to get some more money and come. And it's always hurting me when I'm thinking. Not only I'm thinking that patient, I feel always there are so many women in the countryside who are not able to come to us because they don't have money. In fact, when they come, we refund them. But to begin with, they don't come. Nobody is going to lend to them because these women, they are, isolated, they are rejected. Always, I remember her because it's reminding me other fistula patients who are suffering in the countryside because they don't have money to come to the fistula hospital. You see?
Yeah. Oh, that's beautiful. Absolutely beautiful story. We often talk to our donors, or we'll ask them if they can make a gift that will help transport a woman to the hospital. What better example is there than a woman? It's taken her 7 years of looking after her calf to get her there. Beautiful stories. Well, I am going to just about finish up there because you've shared some beautiful stuff with us. So a combination of both incredibly useful, very informative, but also just it's just lovely to finish on that really happy note. I think that's a really good place to finish. Except that I have got a very important message from one of our supporters, Graham, who lives out in Middle Camberwell in my local, well, not my local area, but in my part of Australia in Victoria. He specifically asked me to pass on his congratulations to you on the work that you do, and to send his well wishes to you. He obviously thinks the work that you do is amazing. So it's my pleasure to pass that on. And of course, just a huge thank you from me and my team, but also from all our supporters for taking the time to talk to us.
Thank you, Sharon. And I want to take this opportunity to pass the message to Ethiopia and Australia through you, for your board or for your all donors. Please say thank you for all what they are doing for the victims of obstetric fistula patients. Thank you, Sharon.
Absolutely, and listen, it's our absolute pleasure to be part of your amazing work. Okay, take care. Goodbye. Enjoy the rest of your day. Bye. Bye-bye.
Thank you. Bye-bye.
Bye.